we have been treating the disease of the patients. But of late, we are talking about fitness, nutrition, lifestyle management, and keeping away all the dependencies, stress management. These are nice, good things. Luckily, I was a military doctor and a sports doctor. So the fittest people in the world are military persons and sports people. Why? Because we take care of their lifestyle more than disease and injury. A lot of people think sports medicine doctor means only to treat sports injuries. It is not correct. Sports medicine actually treats the whole body of a person. How is his stature? How is his body weight? His nutritional indices are fine or not? Is he overweight, obese, or completely undernourished? Does he have any stiff joints? And is he walking style, that is gait, is fine or not? Is the posture followed by him, is he right or wrong? So these things come into picture. And of course, because of the medical background, we treat their diseases. So this is what I feel after 40 years of experience. We need to address every patient's nutritional status by understanding his body weight. Not just measuring one BMI and saying you're overweight or obese. No. You need to understand why that person become obese, why he is into a storage pattern, why person is getting a neck pain and back pain. Does he follow regular fitness regime? At least couple of minutes of walking, jogging, cycling, swimming, calisthenics, or some weight training in gymnasiums or recreational games alone. So when you take history of patients, current illness, presenting symptoms, history of illness, family history, like that we used to record. That is good. But today you need to ask him whether this person has proper breakfast. Does this person eat his own staple food or influenced diet? Is he following correct modification of exercise? Is that lady eating in time in order to keep her thyroid function properly? How is his sleeping posture? How much time he is sleeping? Does he follow any stress coping skills? This is what is the medical needs of a person who needs treatment. A patient comes to a doctor with a lot of expectations, not for just tablets. Of course, today's patient is more intelligent. He'll come to you with a lot of confusion. He'll make you confused also, unfortunately, because of Google IQ. But keeping this apart, patient has a lot of expectations. Now, for example, let us look at the system. In a village, a general practitioner treats every case, every patient from normal small sprain to heat stroke and even heart attack. But he is doing a good job because he is the only person where a common villager, poor person can meet him. Now, what is our responsibility? We have to train these GPs very well. At least he should recognize how the patients present with coronary heart disease, how the patient come with early signs of impaired glucose tolerance. Everybody cannot test by few questions, by examining their habits, by learning their family. To a certain extent we can assess. So our general practitioner needs a lot of training. So I appeal Indian Medical Association, Occupational Health Association. There are so many medical associations. It's not only to conduct a conference in city. So we should think of extending our conferences, workshops, congregations, everything to a village level to train the GP or even a RMP. Don't throw an RMP away. When I went to Tadoba for a tiger sanctuary for photography, my friend had a trouble. When small RMP in the town He had all the medications. He was well aware of treating a gastroenteritis. So we must train these GPs, RMPs. That is one of the many responsibilities of the associations. When a person being referred from a GP for an advanced disease or a serious disease, he approaches a senior consultant or a specialist. So that means specialists should have more time, more appropriate time to examine him and satisfy him than a GP, because he is raised his level up and reached you for a super consultancy, and you don't give him time and you say, sorry, I can only treat you in 2 minutes because I have a lot of patients. No. Yeah, you can very well make a proper planning, give appointments with the time, and give more number of appointments on a very extended days. No problem, people will come. If you say no time for a person who is being referred from one level to second level to third level and reached you, he feels sorry. I think it's our responsibility. Give little more time. I know you're doing a very, very great job. We are all doing a good job. But still, investigations are very nice, because today we believe in evidence-based medicine. Yes, evidence is very important to take a decision. But when we were students, even after passing MBBS, there was no MRI. There was only one CT scan machine somewhere in Osmania General Hospital or something. Not even CT scan machine, ultrasound machine. So do you think all those days, all those great doctors like Dr. Jaswant Rao, Mohammed Azam, Bansilal Vig, still there are senior doctors, Dr. Kasturi, Dr. Dayasagar Rao. There are so many, Dr. Ranga Rao, Dr. A.K. Chari. So all these people, Dr. Vasnarayan, these are all our teachers. They didn't have a CT scans or anything. They could examine and come to a diagnostic level. And surgeries have done, sometimes exploratory surgeries, because to know sometimes their decision was right in performing surgery in time. But today, I am telling you, some of my own friends, without touching the knee joint, is asking for MRI. You need to at least examine the knee joint, how much is range of motion, whether lateral and medial collateral ligaments are fine. ACL and PCL, they have very specific tests to be examined clinically. I feel we should examine clinically and then come to a conclusion and then go for an MRI to confirm what you thought. Invariably, I make a drawing of a spine before taking an MRI. Because of the repetitive strain injury on the spine, it shows straightening of spine, multi-level disc disease, early bulges of certain vulnerable discs. It is possible. Yes, MRI, CT scan, very, very great tools to diagnose tumors, soft tissue injuries, or some unknown diseases, multiple sclerosis, dementias. Yes, they have their own role. But you do have some period before your investigation for a clinical examination. Using our clinical acumen to think, what are we doing? It's a reminder for myself also. I must examine in more detail. So this is what we need to do, and appeal to governments. Yes, we have very big hospitals with a great infrastructure and world-class amenities, but can a common man go there and readily take the advantage of this infrastructure and latest technology? No. It is still far away dream for a very poor employee or a very poor person who cannot afford a bypass surgery or a hip replacement or even a brain surgeries. Many surgeries are not readily affordable. We all agree with that. We need to appeal to the government authorities. We are making bridges, roads, making big statues, thousands of crore rupees. Why can't make our Gandhi hospital, Usmania hospital, super top-notch multi-speciality hospital. One day, when some riot was happening near Usmania hospital, there was no cotton to wipe the blood. I heard in the TV. Even though there are a lot of facilities which are improved, it is better than olden days, but still, these two hospitals and even the government small hubs like primary health centers, district hospitals, need more equipment, greater facilities. They should be equipped with the greater facilities so that the district doctor will not run away to the city. So government should divert a lot of money and also put a small charge. Is it not a good idea to have a 50 rupees fees? People also value prescription advice. They think it is a free fund. Anything you can ask a doctor, he can take and go. That is also not correct. Except UK and India, no other country in the world provides free medicine, free medical treatment. No. They all have insurance cover or some kind of coverage behind. We should improve our government hospitals, make them at par with the corporate hospital, charge little smaller money, provide a better service, and a lot of youth are unemployed. Instead of giving them free fund money, you employ them in hospitals, healthcare advisors, healthcare supporters. They can assist in the near X-ray machines, they can assist in the laboratories, they can assist in the OPDs, they can assist for hygiene and sanitation of the hospital. They can assist in transporting the patients from one ward to the other ward and give them some salary. So government should make a fund for youth to employ them by teaching little skills. They can be a secondary support to our hospitals so that you run the hospital peacefully. Imagine a senior specialist of a government hospital running away. Swab is not there, scissors is not cutting, there is nobody to help. Why should? We have manpower and India is not a poor country. Honorable Prime Minister is saying we are almost 5th place in the world economically. But economics should be seen in our government hospitals and their facilities. Finally, services all should be same. Prices may be different. A rich person can stay in a deluxe room, a poor man can stay in a general ward. But the doctors who see them and the facilities you provide them and medical care you provide them should be same. So our services should be same. Charges may be different based on his economic condition. So these are some thoughts. There are a lot of scope to improve in medical sciences to provide better services. These are only few of my thoughts. I may be right or wrong. You can also think. Thank you.